Swayam Prabha. Digital India. Educated India.
Macro, meso, and micro of healthcare analytics, we first looked at from the healthcare perspective. And we also talked about the power of integration when we left, which is how each of those can feed into the other levels to help out. Now we'll move next to, so now we want to focus on the macro, meso, and micro at supply chain level. If you were going to do analytics, what are the issues? What does it look like is what we want to see. So at the macro level, the supply chain analytics focuses on integrity, resilience, and foresight of the entire national and global healthcare supply network. So the government has to look at totality when they look at, say, for the example, N95 masks. They cannot just look at one region. They have to look at the entire country to see what is the availability, what are the sources. And so the resilience and foresight of the entire national and global also, where they can import and things of that kind. The goal is to anticipate and mitigate any large-scale disruptions like we saw. We are biggest disruption. Inform national policy on strategic resources. So from time to time, the government is supposed to do what's called as a stress test. Many governments do that. A stress test, like you will get on you'll put all the things to your body and you will run and you'll collect all the data. Like that, the government has to stress test the national supply chains, how it withstands any kind of large-scale disasters, whether it is locally focused or it is focused throughout the country, as COVID told us. And ensure the foundational availability of medical goods. So, which again ran into issues when we did with COVID. So what are some of the key characteristics if you are looking at a macro level data analytics at the supply chain issues? So the focus, national supply chain integrity, pandemic preparedness. What are some of the geopolitical risk mitigation? So it need not be always the risks come from a pandemic. What about geopolitical issues? What if countries shut down, tariffs? All those type of things also have impact medical goods, if they are imported. So looking at how do you mitigate? What do you mean by mitigation? What are your other sources from where you can import the same thing? And regulatory compliance. So what are some different regulatory issues to look at? So the data sources for the national supply chain level of analytics is the government data on manufacturing capacity. So government talks about what are the capacities of different types of sectors, how much they can produce, what they can produce, where they can produce, and so on and so forth. Customs and import-export logs that talks about what goods moved through customs, what was actually imported, global shipping and logistics data. If you look at there is an index called LMI, GLI, Global Logistics Index, GLI. So that index is put out by UN every 4 years. And they rank countries. And they rank countries on 4 factors. First factor would be, how is your logistics network looking like? Second factor, what is the per capita the country spends on logistics? Third would be, how are your customs and clearance kind of rules and regulations? And fourth would be, what is the impact of your logistics on climate change? How much of alternate energy logistics are you using? So based on this, they rank countries in general. And this is a self-reported survey, by the way. They don't collect hard data. They send out surveys to logistics people across the globe and get the survey analyzed. And so some of those kind of data is where the global shipping and logistics data come, commodity pricing, strategic national stockpile, which is a number that's available in the US for different kinds of products. What is this strategic national stockpile looking like? So based on these data sources, which might vary, we'll talk when you go to India specific next. I will talk about the data sources for each of that. The analytical methods here is supply chain risk modeling. How do you model risk? The uncertainties. So risk, falls into broadly two categories. Probability of the risk might be high, but the impact of the risk might be not high. Probability of the risk might be low, but the impact of that risk is very high. Example, COVID. Probability of that hopefully never occurs, but such kind of pandemics to occur across the globe, they call it the white swan events, is very, very low. But the impact has been tremendous. Is higher probability risk, somebody forecasting wrongly, very, very likely probable. But the impact that you forecast something wrong is not going to affect the entire country or the entire globe. It may affect your particular business unit or whatever. So the impact is not that high. And so modeling this risk, first of all, is categorizing your different types of risks. And once you categorize the risks, then you can look at, what is the impact? What are the mitigation kind of strategies that are behind mitigating these risks? Some type of an impact is also recovery factor. When this risk hits, what happens? Say this particular supplier shuts down. How soon can they bring online again? So that recovery is also part of modeling the risks. So all that goes into risk, supply chain risk modeling or geopolitical risk analysis. Let me finish this one thing. National level demand sensing. And the government does that a lot, right? So the consumption of some product goes up, they would talk about, or the shortage of a product goes up, then they would talk about pricing and things like that. And network optimization models, I think Professor showed a few of them yesterday. So uncertainty is a kind of a symptom. Risk actually is the cause of that. The outcome of it. The outcome of that would be the risk factor. Right? So they are pretty related, uncertainty. Say that? It's an adjective to classify how bad the risk is. As I said, the risk where you are talking about forecasting error is not going to lead to hazardous kind of conditions unless it is such a big risk. I talked about Wiggly Giggly, somebody forecasted it wrong and the inventory is still sitting after 5 years in a warehouse, but it is not bringing down the company completely or something like that. Whereas something else as, the same company, the PetSmart, they imported products from China, a particular kind of food for the dogs, and one set of product came in with melamine laced foods. Melamine will kill the dog if it is laced in the food, but in a test of protein content, it's a fake way of saying the product has high protein content. So some rogue supplier supplied it and it was unfortunately purchased, and unfortunately, so the stocks tanked. That was an hazardous kind of and that taught PetSmart to start an office in China and put boots on the ground. You verify your supplier yourself, not through a third party or a fourth party. So, two types of risks. One that did not have too much effect would not be characterized as a hazardous. The other one could be disastrous or hazardous. So, very true. So uncertainty kind of qualifies how much of a risk you want to take. Right? If you know the market is not going to do good, you can still take a risk. Some people do. Some people, Yeah, we cannot. We can quantify the risk. Very true. Okay, so key stakeholders, we talked about it, federal agencies, the group purchasing organizations, large-scale manufacturers, international logistic providers. Those people like at the macro level analysis of supply chain analytics. So, where is an application of this? To give a context, let's look at COVID-19 lesson. The pandemic exposed extreme vulnerabilities in the global healthcare supply chain. Macro level analytics are now being used to model and predict the impact of port closures. So when you do a global model and you know that products are coming from different parts of the world, and what the pandemic taught us is some asset can completely shut down. A port can completely close, so products cannot move. So if such a situation were to happen, today we could have more scenario analysis of the impact of that closure on product flows. So that happens at the very macro level. They are not worrying about the product getting into your house. It's more in terms of global flows and what happens. So this allows the governments and GPOs to diversify sourcing, encourage domestic manufacturing. As a matter of fact, more masks in the United States were 3D printed because of the shortage. Interestingly. And then it went back. Now nobody is 3D printing. It's an expensive proposition, by the way. But necessity is the mother of invention. So we had to keep going with that. So, all right, let's move on to the meso level of optimizing health systems, logistical core as a topic. So the meso level drills down into operations of a specific health system. So macro level, logistics and supply chain at the country level or global level. Now you are talking, let Apollo Health Systems look at its logistics service provider as an example here. IDNs is the integrated delivery networks. In the US, bunch of hospitals. You think about logistics, it's a service. You don't have to have your own trucks. You don't have to have your own. So bunch of hospitals can come together and source themselves from a particular service provider providing those kind of logistic services. These hospitals that are coming together are called integrated delivery systems. The focus here is on driving efficiency, mostly controlling the costs and optimizing the flow of goods. Again, that word optimizing. What is the best way to get the product from point A to point B if there are multiple options from the receiving dock to the point of care, this case. So if you look at meso level analysis of supply chains, then you're looking at the focus being inventory optimization now, right? Procurement strategy, vendor management, and internal logistics. The data sources could be your own enterprise resource planning softwares that are running the hospital systems that tells you what you're consuming, when you're buying, and so on and so forth. Or warehouse management systems that are residing in warehouses. Procurement and contract data from group purchasing organizations. Supplier performance scorecards. A scorecard will generally have three things, right? Did the supplier supply on time? Did the supplier supply the amount that you asked for? At what pricing did the supplier supply? These are three scorecarding kind of details. If the supplier gives you a good price but doesn't give you on time, that might increase your inventory because you are expecting the supplier to send it to you in a week, but actually the supplier takes 2 weeks to send it to you. You always have to have an extra week of inventory. So it's going to cost you more even if the supplier says, I'm going to give you at a better price. The supplier says, I'll give you 100% of what you're invoicing you asked, but does not, gives you only 80%. That has an impact also. So those type of uncertainties, normally companies that are managing many suppliers would like to create a scorecard for the suppliers as a way to give feedback, as a way to penalize, as a way to encourage and give more orders if they are good suppliers. So scorecarding is a very important part of analytics at the meso level. Analytical methods, demand forecasting, inventory optimization models. We're not getting in this If you want, come back at some other time. We can do a separate 5 weeks on inventory optimization. Procurement analytics, which is spend analysis and contract compliance. Very important. People who are sitting here who say they are going to be in hospital administration, I would appeal to you, this is an area to think about very carefully. Spend analysis. I told about a very simple example of how I asked my secretary to do analysis on spending in a conference travel. Now take any organization, the spend categories are so many, and millions of rupees are spent on various things. So just analyzing spend, what most importantly people try to analyze is variability around the spend. So if in a particular category, you know you are going to spend say 50 lakh rupees, suddenly it increases to 75, that's a variability. The question is why? So the spend analysis, and the other one is contract data. Large organizations, this is happening at the meso level, so we are talking about multiple hospitals and whatnot. They may have different kind of contracts with the same supplier. And that may create interesting dynamics in terms of pricing, other contract terms. So just looking at contracts that are written with suppliers and trying to analyze and standardize it itself leads to a lot of savings sometimes. So to look at that, one way of analyzing the contract is the same type of contract written at multiple points within this organization. So we will take one supplier, say one type of even simple office supplies, right? Pencils, pens, whatever, office supplies. The supplier might get 6 different contracts from a large organization placing it. If there is no standardization, which is happening today through Ariba and other software, where anybody going and ordering something from this supplier will get the same price, will get the same contract terms. But still there exist situations where even 2 pencils purchased from the same supplier, 2 different contracts might have 2 different prices. Sounds silly, could exist, because they were written at different times when such standardization did not exist. So that's what I mean by contract analysis, is looking at every contract. As contracts get centralized, like the Ariba type of systems, then it becomes a little bit more easier and structured. So, real world application, taming surgical supply costs. A hospital system can use meso level analytics to tackle one of its biggest expense, the operating room. Okay, take you into the operating room. By analyzing surgeon preference cards against actual consumption data from case cards, the system can identify significant waste. In other words, surgeons order something, but they did not use. Ordering versus usage. And if it's a shelf life kind of a item, then it cannot be used again after the shelf life. So things of that happen a lot. By analyzing surgeon preference, identify predictive analytics can then be used to create standardized lean case cards based on actual usage. Why does the lean come? Not by refusing the surgeon, you can never do that, but by saying, you ordered this, but you only use this, I'm going to use what is being used as a way to order, to create lean case cards. Opportunities to consolidate vendors or renegotiate contracts. So all those kind of things can happen once you look at this word called spend analysis. And it can happen at various levels at a meso level. Here is an example of surgical level. In my case, I didn't know whether the doctor had other options. He showed me only one product. Now, if he had multiple products given to him, then what is the cost of each product? I didn't know. Moving on to micro, right? So next to the micro level, the clinically integrated last mile of the supply chain. So the micro level represents the critical last mile, where a product directly intersects with the patient and clinician, right? Analytics at this level are essential for ensuring patient safety, very important. You don't compromise on safety and for price, enabling precise cost tracking, however. It will sound silly to you that we did an analysis. I've not gotten any data from India, but this was in the US, that hospitals, in a particular hospital, there were about probably 75 different surgeons. And for those 75 different surgeons, 30 different surgical gloves were ordered. Different. That's the same functionality, but from different suppliers because they preferred it. And surgeons did not even know that 30 different products has to be maintained. 30 different suppliers have to be maintained for this, which is a cost. So, cost tracking, when they say enabling precise cost tracking, those are some of the things I'm talking about. Connecting supply usage directly to patient outcomes. Key characteristics: patient level supply traceability, point of use efficiency, and clinical financial integration. Point of use efficiency, this is an example. If gloves that did the same work, and if I can cut down on the number of types of gloves I have to source, then I am sourcing the gloves efficiently, which means it's giving me cost saving. That's the point of use efficiency. That means clinical financial integration. Sometimes the costing, the clinical part versus the financial part do not talk to each other. The nurse orders and things of that kind. So that's what we mean by clinical financial integration. So the data sources here: point of use barcode scanning data, the UDI or the unique device identification, and other kinds of devices that can be used to track and trace. The analytical methods here are traceability analysis, physician practice pattern analysis, and comparative cost effectiveness analysis at the procedural level. My most fun course that I've taught is supply chain for physicians, having a room full of physicians. Every word they said, I said, they looked at me like I was a villain. They kept telling me, but we save lives. I said, I never deny that. I'm thankful for it. But you can save it with lesser cost. It's pretty simple. I mean, data is more important. So, we collected data and presented the data. This was part of an executive MBA course, so we had time. So, we gave them projects to work on. Go back to your hospital system and actually ask your procurement person whom they have never met in their entire lives to see how many different surgical gloves they do. And just understand, for each, if a product is manufactured, right? This product is manufactured. We can cost this product, right? Cost of this bottle, cost of this cap, labor that goes in, some profit margin. You can do that. Why can't you do it to a knee surgery? What is?
It's a surgery, but
No. That's a different one. If that's an unsuccessful versus successful, that's a different cost. That's a readmission type of metric that comes in. I'm talking about a standardized knee surgery means A, B, C, D, and E, and these are the kind of metal screws and things that go into that surgery. So you could cost, there's a kit that's used for every surgery. I'm not costing, then there's a time to do that surgery. There are metrics on surgeon times. So, a lot of these things are repeated, including my surgery is repeatable. The surgeon did not do it for the first time on me. I might be a unique case in what they wanted to do on me. But this is Bentel procedure. That's why it's a Wikipedia term, right? When you type in Bentel, it comes up. So, anything that is repeatable, you could study it more carefully to see what should be the cost. Cost is an information. Cost is not the final decision. You need to understand. That's what I tell the physicians. It's an information to you. What is more interesting is if two surgeons are doing the same surgery, but we can see that one is more costlier than the other. Not the surgeon pay. The surgeon pay is determined by the market. So I am not going to go there. So after the surgeon pay, what is left? Only the material costs.
By what benefit?
What? I'm not understanding the question.
What benefit?
The benefit is to me, the patient. I don't have to pay more. To somebody, that's the benefit, right? The benefit is to the hospital system for what they have to source and maintain and inventory costs. If there are two products that are going for the same surgery, but I have sourced these two products from two different suppliers, and I have to maintain inventory on them. And say the inventory is maintained by how much is my holding cost, the cost to hold the item till it is used. The holding cost is a percentage of the cost of the item. So if this is 100 rupees and this is 200 rupees and my holding cost is 5%, it is going to take me more to hold this than this financially. This could be more insurance that I have to pay. That's why that 5% of this. So if both were 100 rupees that I'm going to use, the benefit is to the particular hospital system. What's that? Traceability analysis is again the type of products that have come in, where they are. Sometimes, it is very difficult to see products moving through a system. Right, so they are trying to, when a scan happens, oftentimes when remember the first day we talked about the valve? Sometimes what happens is the nurses hold it somewhere and are not traced. So you could go actually find out there is more valves available. If the valves all went through some kind of a scanning when they came in, today they are barcode, the other kinds of technologies by which as the product comes into storage, it automatically gets scanned, automatically gets updated into a system. Such things help increase the inventory accuracy. Traceability is a very critical component of inventory accuracy. Inventory accuracy is number one issue why inventory costs go up, because wrong inventory information is there, including the example of yogurt scanning. What's that? Traceability analysis is more to do with auditing. It's more auditing. Is there what it is, kind of an auditing. You were saying something.
Just because of that, customer is asking for a certification from the end OEM manufacturer that yes, it's not tampered proofed in the it's non-contaminated, and the process was this was the written from the source. Nobody has tampered in between the shipment. So it's very it's come under traceability. If we had something to measure at the same all level and information is there, this case could not be there. But unless and until they are directly saying, unless and until you are giving me in written from the manufacturer that yes, this is from the source, we are not going to accept it.
Sure.
It's a very standard item. One pharmaceutical companies, they realized that they were doing spend analysis. Then they realized that whenever a new scientist is hired, they would prefer a special quality and special brand of beaker, which is a very standard item. And they identified that every new scientist would ask for the brand of their choice. Okay. So, and the procurement guy would listen to them and buy. And when that spend analysis was done, they found that, many lakhs and lakhs of INR could have been saved had they ordered the standard products from single source. So, that is the cost effectiveness,
And the benefit of that is saving.
savings. Yes. But when we say cost benefit analysis, so here we are concentrating on how we can rationalize the cost or the sourcing. So how we can make it effective, So, right. Correct. And for traceability, you might have heard the news these days, lot many recalls happen in food, in pharma, in even in auto sector, the cars are recalled. So then if that happens, how we can trace back, which batch is defective, So their traceability analysis is very, very important. Otherwise, it is very difficult, to identify, So that's why, quickly, if traceability is there, we can quickly warn the customers, stop using that batch, this is the whole recall thing can be controlled if we have a good traceability analysis. Exactly. Yes.
I think that's I had that as an example. So the medical device recall is an example.
Making the climax. Sorry.
No, you, it's validation of the example here. So, you're talking any type of recall, anything that happens, how do you trace those things back to the patients? Is a question. Okay. So this is now we are finished. Macro-meso-micro at national healthcare level, at the supply chain level. Now let's take it. The power of integration. One more time. What happens when each of the levels are integrated for supply chain now? So a true transformation occurs when these three levels are connected by data, creating a feedback loop for continuous improvement, which we call a clinically integrated supply chain. So micro to meso, a micro level analysis reveals that two surgeons are using different high cost supplies for the same procedure with identical patient outcomes. Okay, so we got to be careful. Patient outcomes, if it varies, then that's not the right spend analysis. Patient outcomes are the same, but they are using two different high cost supplies. This data flows up to the meso level, where supply chain leaders can use it to engage the surgeons in conversation about standardizing to the more cost-effective option. Not always successful, but you got to. It also depends on private versus government kind of things in this case, impacting the hospital's bottom line. So meso to macro. So this is micro to meso, actually going the other way, from a micro level analysis going up to meso. So meso to macro, when thousands of hospitals provide data on supply reliability and product shortages to their GPOs, this aggregated data can be analyzed at the macro level. This allows the GPO to negotiate more resilient national contracts and provide early warnings to the federal government about potential systemic supply chain weaknesses. So that happened during COVID. People at that level started talking about shortages in PPE and surgical gloves and what they need to do to get it. So some challenges and path forward, if you look at it, what happens to the challenges at the supply chain level? Again, the lack of, we all talk about traceability, but when a product moves from point A to point B to point C, if the identification of the product keeps changing, there is one barcode here, it comes here, it becomes a different barcode, third barcode, then it's very difficult to do the traceability. So that is why in the medical, it's more important to have that. So they are talking about the UDI or the universal data identification. But again, it's all sometimes government type of policies that plays into all these kind of, and it's a cost also. People have their own system as to how they are taking and tracing and tracking. If you want to change that, that needs investment. That also slows down things. So the UDI adoption is an important one. Data integration, merging data from clinical systems and business systems. Very, very interesting. People here in hospital administration, people who deal with business systems, the enterprise resource planning softwares, versus the medical or clinical systems, which comes through electronic health records. Both integrating that is also a challenge. because it's the physician is dealing with EHRs most of the times. All the supply chain people are going to deal with the ERP. So if those two don't talk to each other, then you have that data integration issue. Supplier data transparency, a lack of visibility. Again, we talked about this even yesterday. Beyond your first year, lack of visibility of those suppliers. And the change management, gaining buy-in from the clinicians to participate in supply chain initiatives is crucial. It's becoming a little better after COVID, but still, physicians definitely live in their world. I have two at home, so I know them. Yeah. Okay. Yeah, want to take that? Try that.
For some words, we need to refer to dictionary. What is the real meaning, right? So in context of supply chain, I can say that, supply chain visibility is like, when you are able to very similar to the traceability and tracking, So that is actually a part of tracing and tracking is a part of visibility. Okay, so that I can see, I can track the product downwards, where my product is going, how it is going, and I can trace back the provenance of the product. So when I'm able to do that, that is more of a visibility. This is called supply chain visibility, whether I'm able to track and trace the product, whether it is under my control. For that we need data, right? Data, we need maybe GIS, we need to do this tracking tracing on real time, so that I should have a visibility over that. Okay, so transparency is if it is not there, if visibility is not there, if data is not shared by the next supply chain entity or the supply chain entity in the upward, so if they are not ready to share, if they are not transparent, I think transparency is more of a behavioral this thing, of behavioral attribute of supply chain entity. If they are not transparent, they are not sharing data, if you cannot access it, so then it is difficult to have clear visibility. So yeah, but maybe you can strengthen.
No, well said. I would just add to that saying, just because something is visible doesn't mean it is transparent. Numbers lie. So I can share the numbers with you, but they may not be updated, whatever it is. And so I may not be transparent with you. So that's a behavioral thing, very rightly said by the professor. But when Walmart and Procter & Gamble did CPFR, the collaborative planning, forecasting, replenishment, they had to be transparent if they are going to do anything marketing campaign. Right? They're going to do a marketing campaign. They could still share their forecasting. They could say, hey, my forecasting is going to be off by 10%. It's outside the range. Now, the transparency comes why? Why are they predicting that way? If they are not ready to be transparent, then Walmart or Procter & Gamble, whoever is doing it to the other, would be in the dark as to why this is happening, which used to happen a lot, even within a company. So the same PetSmart, the company that I talked about, the pet food industry, the marketing department would start putting products on sale with a discount, but not share that information with the logistics department. Now, why is it creating issues for the logistics department? Customers suddenly that weekend, whatever it is, are going to buy more of the product because they are on sale if they need it. But if it's not available, who makes it available to these are days before it's online, it's on the stores. who makes it available in the stores? It's the logistics people. How can they make more products available in the stores? By shipping more products from their warehouse to the stores. If they are not transparent about this particular marketing campaign, then supply chain is going to go by few past data, which is visible. Past data is visible and going to send the same type of products to the stores, when in fact the behavior of the customer is going to change because of this impact of marketing. So an example of visibility versus transparency. Okay. All right, take a few minutes. Now that I have given you two different presentations, one at the healthcare level, one at the supply chain level, what do you think should be a macro, meso and micro framework for healthcare supply chain management in India based on what you saw? And I expect all the CMC people to come up with the best answers to this question. Competition between them and the rest of the class. So I want you to think at the macro level, what are the issues that you think Indian healthcare is going to face from a supply chain standpoint? At the meso level and at the micro level. Write down, please. 2 or 3 points for each of these. I'm going to leave those things to you. I only throw these things on the screen and then Sujan will tell you.
Right.
Yeah.
So can it take the new one? Right.
Yeah, Sujan is going to. Yeah. Collaborate, please.
Right. Yeah, you have some thoughts.
You tell me. You are my guru. All right. What do we have?
That's what we
I want that group at the very back to start. Right there. Those two young ladies never opened their mouths.
Right. Something let's say that.
Please introduce also, okay?
Hi all, I'm Steffi Vanslin. I'm currently pursuing my Masters of Hospital Administration at CMC. So as a group, we are a group of 4.
Okay, I want you to first talk about macro.
Okay.
Then I want to go around and ask for other things to macro. Like that we will go. So let's talk about macro first.
So macro, the points that we have covered are develop national policies and digital health, and invest in cold chains, warehousing and transport infrastructure, ensure resilience during pandemics.
Hold on, give us 1 minute.
Please.
So that we can have an inventory of ideas here. Yeah, into this itself, Suja, you can put it into that. I'm going to take it up. Yeah. So that we can share this information. It comes from all of you.
Well, I don't.
Here. Right? Okay. Okay. Start again, please, with your.
Yeah.
I heard something on digital.
Yeah. The first one is develop national policies and digital health.
Digital app. Okay.
Invest in cold chains, warehousing and transport infrastructure.
What? Explain to me why you are thinking that, or your team is thinking. You can take the mic and talk too.
So, sir, this point we have written like based on CMC what they are practicing. It's like they have one separate building for the storage. And then pharmacy is also like for like they have bigger pharmacy and then to smaller pharmacy. It depends on department. So let's say for derm they have separate pharmacy, for pediatrics they have separate pharmacy. So this is like one is the main pharmacy. From there they will move it to the separate pharmacy, and then that from that pharmacy it will directly go to patient. So it's like kind of they won't mix. So where to go, which one to go, that they will already they'll do it previously, so that the exact medicine should reach the exact department like that.
That I understand. But
Okay.
at a macro level, you guys have said, let's have a national cold chain. What made you think about a national cold chain storage kind of that the government has to do? Because remember, the macro, the investment is done by the government. So if you can help me understand, I'm not saying you're wrong. I just want to know why you thought that, why the group thought that.
The cold chain basically macro level, because the like during the transportation sometimes if it is not available, so that medicine will get like it won't be useful and it will become ineffective also. So that should be there so that it can reach to the person with the higher efficiency.
Okay, good. Anything else on the macro?
Ensure resilience during pandemics.
Ensure resilience during pandemic. That's like telling a movie director, give me a good movie.
Next one, we have added government sponsors for data infrastructures.
Okay.
Then unique health ID, where there's a collaboration of the unique ID both with the government and the private hospitals.
Okay.
These were the macro points.
Beautiful. Who wants to go on market? Yeah, macro, get here. See, if your ideas are already listed, please add to it.
So adding on, sir, so I just want to detail that. So the drug thing, so those who can afford the cancer drug, they can afford it from the CMC. If not, what they're doing is that they will refer to the cancer drug, like from the Cancer Institute of Adyar or somewhere. They can get it from there because it's free of cost. So I wanted to relate that macro level in that aspect. I just want to, maybe she couldn't able to explain it very clearly. I think I don't know, is it right or wrong?
I'm not following. Say what you're
So at macro level, sir, so based on the pharmacy I'm talking about, the drug,
pharmacy, okay.
the drug. So the cancer drugs, it can be got from the government as well. Those who can afford can get it from CMC, like at the paying cost. If not, they can get the prescription from the Cancer Institute of Adyar, something like that. They can get it free. So in terms of national health, I want to relate it. I want to add on that.
Okay. Okay. So the macro, what you're saying is the prescription management comes from somebody like CMC. The distribution comes from where it's affordable. So that's good. That's good.
Yes.
Yeah.
Also availability as well. If the drug is not available here,
Good point. Good point. Macro. Anybody else has anything else?
Availability and subsidy.
Subha. Okay. Okay. Take it there. Okay.
Good afternoon, sir. I'm Vishali. I'm studying PGDH in CMC Vellore. We have written all the points based on vaccines. So, in macro level, we would like to add pharmacovigilance program, which is national based, and national standards for vaccine quality, with collaboration with WHO and ICMR. So, these are the points which we would.
Okay. I want to go to the first one. Explain to me what this word that.
Pharmacovigilance.
Oh my goodness. At 3 o'clock in the afternoon.
So, I'm basically a nurse by profession.
Yeah, go ahead.
So I worked in pediatric OPD. So I used to put vaccines for children. So I know there are adverse drug reaction after giving vaccines to baby. So there is specialized forms available wherein we can fill it and report it to the central like pharmacovigilance committees. So they take actions and
This is a very interesting research area because one of the speaker, if you remember in POMS we had, they're doing research that, how to digitalize it, which tablets, have it was, which two tablets can react, so very interesting.
Thank you, Vishal. Appreciate. Who else? Macro. The team here, please.
So you have to tell fast, tea is waiting outside.
Okay.
Yeah, quickly.
Sir, we are formulating about the hypertensive drug supply chain under the national
Hypertension drug supply chain.
NCD, under NCD program.
Okay.
So the government used to make framework for the policy, and therefore they give guidelines, and they also regulate the pharmaceutical companies from where we need to purchase, maintaining the quality of the drugs. And they give fund to the state government. Up to the state government, they go for the tendering process, and they have their own team for technical bids and financial bids. After the financial bids get cleared, they purchase it with a lead time on average of 4 months. They supply it to the district level. Before that, they take feedback, or they take the demands from the districts about based on the population. District have their own data. So they give the demand, accordingly they supply. From district level, it comes to the substocks or the facilities. And from facilities, most of the doctors are based in facilities. In sub-center, we have this telemedicine things. And from telemedicine consultation, they come to the facility to take the drugs. So in that way, the supply chain goes on. And the entire thing is been digitalized. Means the demand is placed in digital platform. That from there, the district makes some analysis, and then they put back to the state level.
So both examples that we heard are examples where macro, meso, micro are actually integrated. That's the example you actually gave us. At the macro level is the establishment of protocols for hypertension, the type of drugs that are effective for hypertension, and also sourcing the components needed, that at the macro level. And afterwards, it flows down to the state level, which is meso, to the hospital level, which is micro. So, okay, you want to take a break now, or you want to?
So, audience will decide. The copy first, or like the macro will be.
Yeah. Okay, let's finish macro.
Macro, we have put 2 points. What in addition, the first one is unequal distribution or excess of health infrastructure in urban and rural part, where like hospitals or medical healthcare professionals cannot do much. Government had to look into it and distribute the infrastructures facilities. And the second thing is political instability in any country. Like the first government or government in power will definitely do many things, many projects they will run, but the other party, when they come, they will say, no, this is not good, let's stop it and do it something else. So in turn, we are like wasting the facilities in the first project, and we are stopping it somewhere else, and again we are restarting, reprogramming it. So these 2 things which we could.
Very good, very good. Anybody else make macro?
On Bharat, Pradhan Mantri Ayushman Bharat Yojana, which again will set the whole supply chain management for healthcare, both rural and urban. It includes both workforce, doctors, in terms of supply of medicines, consumables, everything. And the anti-cancer medicine that he was talking, Alfred, that we have this Amrit Pharmacy by the ministry, where there are several franchises across the country that can deliver affordable medicines. But maybe I should talk that in the micro level, where patient doesn't actually get medicines at an affordable cost, even though it is. And there are outlets by the Ministry of Health, Jan Aushadhi outlets across the country to deliver these free medicines, but quality is an issue.
Okay. Anybody else? Macro? Lot of examples. I hope you paid attention. Each one of them makes sense to me. Yeah. Thank you.